session is a Life After Cancer Education series. This topic is Surviving Now What? So this is the first of 5. So this session is virtual, so we do ask that you keep your microphones muted during the presentation, but if you choose to ask your question over the microphone, you can do that, or you can use the chat. But while presenting, we just ask that you keep your microphone muted. A recording of the presentation slides and the recording will be shared with you after the presentation, so you can ask for any extra notes or anything, but everything will be shared with you. If you have questions afterwards, you can email them to me at renew@wrh.on.ca. And then we'll also include a feedback survey. So if there's any topics that any items that you feel could be added, or anything else that you think may be beneficial to future Renew presentations, you can include that on the survey. So our first presenter is our nurse practitioner, Kit McCann. So this first session just discusses the next steps after treatment, long-term physical effects of treatment, dealing with emotional, psychological concerns, and any kind of community resources we have available. We'll touch on that as well. So today, the objective for today is to walk away with information about what to expect after your cancer treatment has ended. Today's objective is also to provide you with resources that can provide a more in-depth information or support in the community. So what is Renew? So Renew was developed specifically for patients that have completed cancer treatment. So there's a 5-part educational series, and prior to COVID, we did also offer an exercise program. We're hoping to get this refreshed and revitalized this year. So if you're interested in that, you can always send me an email. And if the exercise program gets off the ground, which we will hope will be by summertime, we would love for you to participate. So the Renew program focuses on resources, education, nutrition, exercise, and wellness. So it's developed by the Cancer Program, and with research, medical literature, best practices, and considering patients and their families. So you can attend all 5 sessions. Like I said, if you're not able to join a session, it will be emailed to you. And for future sessions, if you would like to have somebody join you, a family, friend, caregiver, they're welcome to join as well. Registration is needed for each session, but when you register, that link will allow you to join all 5 sessions. So this program, it's important because we're trying to emphasize the next journey, the next part of your journey, and help you prepare to return to healthy living and help you feel empowered. So we'll get into Kit's presentation. So Kit is one of our nurse practitioners within the Cancer Program, and she's been presenting with the Renew program for quite some time. So welcome, Kit.
Thanks, and good evening, everyone. I just want to remind you, if you're not muted, to mute your microphone. So if you don't see a little red microphone with a line through it on your screen, then you're not yet muted. As Shannon said, I'm Kit McCann. I am one of the nurse practitioners at the Cancer Center, and I've been with this Renew program since it started many, many years ago. And although I work in acute leukemia and transplant, had a very special interest in survivorship because it really felt like we weren't doing enough for patients after discharge. And I'm sure a lot of you will agree that you feel like you have lots of information along the way. And then when treatment ends, it becomes this kind of new world that you need to navigate and trying to figure out kind of where do you go from there. And so you see on this whole cancer journey, you know, you've been through first steps and some treatment, and you've probably even talked about discharge with your oncologist. And now you're in this little box about living well and wondering kind of what does that mean and how do you transition back to community and to primary care and to kind of life after cancer. Next slide. Many cancer survivors tell us that they feel like they did have lots of information during their information and support during their treatment. But once that stopped, they felt like they entered a whole new world. And this is a really common feeling and a common reaction. And so the whole Renew program was designed to kind of help with this transition. Of course, it isn't perfect. There's lots of types of cancers and there are different treatments. And so we can't possibly address them all. But the hope for tonight is to just give you some comfort moving into the survivorship phase, knowing that there's a tremendous opportunity for growth after treatment is completed, and helping you to understand how to make the most of your follow-up visits. Next slide. Who is a survivor? So we say this includes anyone who's been diagnosed with cancer from the time of diagnosis through the rest of your life. So if that is you, you are considered a survivor to us and to everyone. But we also consider family members, friends, and caregivers as survivors as well, because for those family members and friends and caregivers who journeyed with you, they really invested a lot emotionally and probably physically to get you here as well. Next slide. People want to know, am I ever going to feel normal again? Lots of times when treatment ends, there's lots of fatigue or lingering symptoms. Your stamina may not be that good, appetite. There could be all kinds of things depending on what your treatment was. And we often hear that people weren't prepared for what to expect, and that there's this kind of unrealistic expectation of patients that, you know, they're gonna complete treatment and return right to their pre-treatment self with the same amount of energy and stamina and appetite and all of those things. And then they're a little disappointed when treatment ends and they feel like there's just some lingering symptoms and there's this unexpected time of transition after treatment. Really, what's important now is, you know, the question is, will I be normal again? And the answer is yes, you'll be normal again, but that is going to be a new normal. And it's for each of you to figure out what your new normal looks like. In terms of follow-up care, we know that all survivors need to have some follow-up care. And this is really one easy blanket statement, but it really depends on the type of treatment, you know, your overall health when you finish treatment. And there are established guidelines. And so hopefully prior to your discharge from the cancer center, or when the time from follow-up is getting spaced out, you've had a chance to talk with your team and really kind of hear what is expected in terms of how often do you need scans? How often do you need blood work? How often should you be seen by an oncologist? What does the family doctor take over from here? And so it's super important at this point to get really involved in guiding your care so that you can regain some of the control, because your care is probably going to get split between specialist and family doctor, and you're going to learn to navigate kind of a new way of dealing with your health. Some things will continue to take place at the cancer center, while others will move back to primary care physicians and providers. Next slide. And so we say, you know, in general, survivors usually return to their providers every 3 to 4 months during the first 2 to 3 years after treatment, and maybe once or twice after that. But again, it depends on the type of treatment you had, the side effects that you might be dealing with, and what were your pre-existing comorbidities? What, you know, did you have hypertension, diabetes, all of those things to begin with that now need to be managed again. And so we say, here are some common questions about your follow-up care so that when you present for a visit, you're really ready, you're prepared to get the information that you know you need out of that visit. Next slide. How long does it take to recover? And this is going to be different for everyone. Again, I can't stress enough, and I tell all my patients this, that the the return to your new normal and kind of figuring out your new normal, people think like you end treatment here and you're going to feel like your normal self up here, and it just kind of goes like this, and every day brings you closer to that new spot. However, what we know for certain is people feel very different than that. And in fact, you have a good day and it might lead to a bad day, and you might have a good month and it might lead to some fatigue. And so you get up here, you get to that recovery phase, but it is not a straight shot up. There's lots of ups and downs along the way, and patients often aren't prepared for those bumps in the road. And then there's also kind of fear of cancer. Is this cancer going to come back? What can I do to prevent this cancer from coming back? And what supports are available if I'm not going to be at the cancer center, or I'm not going to meet with my oncologist and team as frequently as I did before? Next slide. And so it's important that you develop your own sort of wellness plan. And so this is the things that you need to do to reduce your risks of cancer coming back. And so these may be lifestyle things, these may be medical procedures, they may be medications. And survivorship now is this time where you take a look at how you take care of yourself, how you can continue living on, and possibly start even living on in a healthier way than you did before, taking into consideration all of the things that you've been through. So you develop this wellness plan that includes taking care of your physical, emotional, social, and spiritual self. And each of these is really important in terms of moving forward. Talking to your healthcare provider is really important, because the less you present to your oncologist, the less time you have with them. And so when you have an appointment, you really want to make the most of it and be able to talk to them in a way that you can discuss new symptoms or new pains that are troubling you, any other medical problems that are going on, things that may have been discussed with your primary care provider, or even what are some of the wellness things that have to happen for you. You're going to look at some of the medications, and maybe there's some emotional issues, some emotional anxiety or depression that have come and that are new to you following treatment, or maybe they were there before and not that bad during treatment, and maybe symptoms are recurring. We also want you to be able to talk about changes in your family medical history, because we know that family medical histories are important in terms of disease risk. And so what we want you to always know is to prepare before you go, so that you have your questions, you know what your most important issues are going to be, so that when you present to your visit, and you can make the most of that visit while you're there. And then before you leave, make sure your questions are answered. You know what the plan is, you know who's going to be taking care of what, you know what the problems are that you should call back for, et cetera, et cetera, et cetera. So 2 slides, Shannon. I think I spoke to both of those. Yeah. And so that's really kind of just preparing yourself for the little visits in between, the long spaces where you're not at the cancer center, or you're not with your treating oncologist anymore. The next part is kind of looking at some of the long-term effects of treatment. And so we've alluded to some of these symptoms, and they're going to be different for everyone depending on what type of treatment, how long you were in treatment, how you managed your treatment, how maybe how deconditioned you became during treatment. But for sure, we do recognize that there are lots of physical, emotional, and psychosocial long-term effects that happen. And so when I mentioned in the beginning that sometimes we don't prepare our patients well enough to have realistic expectations, I think this is where people are hit the hardest, when there's these lingering symptoms, whether they're physical, emotional, psychological, whatever, and you enter into your transition to survivorship, thinking that you get to start your new life all over again and get to go back to the pre-cancer diagnosis self that you were, in terms of energy, stamina, maybe your work, your friends, your relationships, all of those things that have possibly been impacted during your treatment. Fatigue is for sure the most common symptom during the first year after treatment, and for some it is longer than a year. This is different. This is the kind of fatigue that is not relieved by simply sleeping 8 hours at night or taking a nap during the day. There's no normal pattern to it. It sometimes is you push yourself one day and you're incredibly fatigued the next day, or it might be 2 days or 3 days later. It might be the lack of motivation combined with fatigue, and you can't really put your finger on what's causing it or how to get through it. It likely will get better over time, but some patients still feel energy loss years later. And that's part of figuring out the new normal, is what really is your new baseline energy. This can be really frustrating for patients if their expectation is to finish treatment and return to their previous normal right away. So in terms of coping with fatigue, there's lots of little things that can be done. We say plan your day so that if you're waking up refreshed, plan your hardest, most strenuous activities in the morning when you feel you might have the most energy to do it. Listen to your body, take naps, take rests, save your energy by maybe not doing some of the things that you normally do, or when people offer to help, to accept that help, or by changing how you do things. For example, cooking. You may have to sit down to do some cooking. It may not be an activity that you can stand and exert yourself for long periods of time. Choose how you spend your energy. Some things just aren't worth the waste of your energy if you know that it causes some profound fatigue. And then, still do what you enjoy, but maybe do less of it or change how you do it so that you're getting enjoyment in there. Next slide. Memory and concentration. And so we joke about chemo brain, but it's a real thing. And I think if I asked for a show of hands, which I won't do, almost everybody would put up their hand and say, not only during treatment, but for sure after treatment, my memory has changed. I don't have the concentration that I used to have. I feel foggy, or my attention span just isn't what it used to be. I'm having trouble remembering words or things that I think I'm going to remember and then I can't. And this actually begins soon after treatment starts and lasts for a long time for some people. It's a real thing. We actually don't know the pathophysiology behind it, but we do know that upwards of, so they say 1 in 4 survivors report this chemo brain fog. That's afterwards. So at least 25% of people. I would say it's probably much higher. It does drop off quickly for some people, but up to 70% of patients during treatment are feeling this. And so most people, I find, aren't experiencing this as a new symptom after treatment, because it's sort of been part of the process all along. So in terms of helpful tips, like write things down, keep a notebook, set up little reminders in your phone or sticky notes all over the house if that's what it takes. Talk yourself through tasks. They say if you can talk yourself through a task, you're way more likely to remember it the next time. So for an example would be when you're making a recipe, you're measuring 2 cups of this and you're doing this, and then I'm going to boil this first before I add this, and then I'm going to stir, and then this gets added last. And so if it might feel silly, but if you talk yourself through some of those activities, then you have a greater chance of remembering it when you need it again. For sure, we say managing stress is important. Memory and concentration on a good day are affected by stress. And your body's been through a lot of stress and a prolonged amount of stress. And so getting that managed is super important to improving memory and concentration as well. Sometimes you have to plan ahead if you're going to be in a social situation and you're not sure what you want to say, or you're not sure how you want to describe something. It helps to plan ahead and have an idea of what you want to say and run through it a few times so that when you're in the situation, you can do it with a little more ease. Next is pain. And again, this is a high symptom burden for patients in transition. It didn't just disappear with the end of treatment. It actually may have been caused by treatment. So we talk about neuropathic pain, and lots of the chemotherapies that we deliver and surgeries where nerves are cut end up in some neuropathy, some numbness to the hands or feet from chemos, potentially scars from surgery. Maybe you're missing a part of your body that was removed and you're learning to deal with the physical absence of it, or maybe there's an organ that has changed function because of parts being removed. And other things may have developed during your treatment that are not even related to your cancer, but also result in some pain. It's really important to be able to talk to your healthcare provider about this so that we can attempt to manage it for you. And then learning some of the for sure pain meds can be prescribed, but learning some of the non-pharmacological things, like is physiotherapy and exercise rehab a possibility, and would it help? Is there maybe meditation or yoga or non-pharmacologic things? Learning how to relax and manage stress once again, but also maybe it is joint injections or nerve blocks or something that needs to be done to relieve pain. We know that if you're living in pain, you're probably not getting up to where you want to be in terms of recovery of your physical stamina and other things. And so it's really important to be able to have the conversation so we can find the source to help you get some relief. Neuropathy, I alluded to a little bit when there's damage to the nerves, and this is the slowest part of the entire body to heal. Things heal generally really well. Nerves heal very, very slow. And so if it's damage related to the chemotherapy or to surgery, it can take a long time for that to heal. It may never heal perfectly. We talk about like peripheral neuropathy. So lots of chemos can cause some neuropathy to the fingertips and the toes, and sometimes it even spreads up like a glove or a sock, where it can change the way you walk. It might impair your ability to put in an earring or do up a button because the fingertips can get so numb. These conditions can be made worse by other conditions like diabetes, kidney failure, alcoholism, or poor nutrition. And so we need to get to the bottom of those too, because until those things are corrected, then there isn't going to be a repair of the nerves, even though it's slow. Next slide. So common symptoms of neuropathy, and these ones tend to linger, are tingling, burning, numbness or a sharp feeling in the fingers or toes, stabbing, electric pain sensations. There may be a loss of sensation. You may no longer be able to feel hot or cold, and that becomes a little bit dangerous because if you're doing something where you can burn your fingers or feet, but you don't have the sensation for hot and cold, then you can end up with blisters and secondary skin infections and those kind of things. It can make walking hard. Believe it or not, enough neuropathy in the feet can change the way you walk. It almost feels like you have wood blocks on your feet and your feet just kind of pound. It makes falling, it makes you clumsy, and it makes you a fall risk. And we know for sure what goes along with fall risks is broken bones, and we certainly don't want to have any of that. Nerves innervate the bowels as well. And so while we can easily pick up neuropathy in the fingers and toes, there can be like nerve damage in for hearing, for constipation, for the bowels leading to constipation. And those things need to be addressed too, because sometimes we have to overcome that with medication. Next slide, please, Shannon. Lymphedema or swelling, we typically think of in breast cancer, but anyone who's had abdominal surgery that has impacted lymph nodes, had lymph nodes removed. So lots of lower abdominal surgery can result in lymphedema or swelling in the lower extremities, as well as in the arms on the side of an affected breast. So it's basically a swelling that's a buildup of lymph fluid, usually in like anywhere in the neck, arms, face, and then again in the legs for a lower abdominal surgery. It can be mild. It can be something that sets it off, and it can get better. Lots of people will wear a sleeve, but it can also be exacerbated by something as simple as an insect bite or a little cut or a little burn that causes an immune reaction and swelling in the area. Next slide. There are, so the people who are at risk, we talked about breast, especially if there's been lymph node removals, but also radiation to the area. Melanoma, where things have been removed and likely lymph nodes have been sampled and removed as well as prostate, all the reproductive, so endometrial, cervical, ovarian, because lymph node removal is often part of the surgery for those cancer types, and also there's lymph node removals, and then again lower abdomen, as we discussed. So some of the things that you can do, sorry, Shannon, to relieve lymphedema or treat it is keeping them raised above the heart. So having them raised legs or arms, good weight control. People wear lymphedema sleeves to manage the swelling. Avoiding procedures in the area. So we tell people don't have your blood drawn in that arm on the side of a lymph node removal anymore. Try not to have blood pressure taken on that side. Anything that can cause kind of a swelling or an infection. Really good sunscreen and keeping it free of cuts. So you wouldn't want to use this arm unprotected to trim bushes and things where you might get scratched, cat scratches. We want to avoid that kind of thing. And then in terms of diet, eating a really good diet that is protein rich so that it can help fluids stay in the vascular system and not leaking into the arms. Loose fitting clothing, so tight clothing is bad for lymphedema. And then also regular follow-ups. There are massage therapists who can be registered for lymphedema specialty, and so you can have massage for lymphedema as well. Most important though is really to protect the area so that it doesn't sustain any kind of abrasions, cuts, assault, or anything like that. Next slide. Lots of people who finish treatment have mouth or teeth problems. And this is one of those things where when you're in treatment and having chemo or radiation, taking care of your teeth or getting dental work done. In fact, we actually ask you not to sometimes if counts are going to be low or there's a risk for infection. So this is one of the things that kind of gets pushed aside, or you deal with it without giving it much thought. And then afterwards, you kind of realize, wow, I really have some stuff going on in here that I should probably get taken care of. So they estimate about 2 out of 5 people treated with chemotherapy. I deal with bone marrow transplant patients, and so we see a lot of mouth or teeth problems, some from the drugs that we use, some from the medications that cause prolonged dry mouth, and lots of you may have experienced that as well. So patients might, next slide, experience not just dry mouth, but maybe early decay or problems with gums, changes in taste for sure. People will describe often a really awful metallic taste after therapy that takes a long time to go away. Painful mouth or jaw. Again, we talked about neuropathy can affect the jaw as well, which can cause some stiffness or changes in the structure of the jawbone. And then infections. And so we encourage, obviously through treatment, but into survivorship as well, really good mouth care, keeping things moist. So using a moistener if needed, chewing on sugarless gum, or I always tell my patients the Bulk Barn sells sugar-free lemon drops. And so this is, if you're having trouble with dry mouth, it's a really easy way to do it. Because the lemon it makes you pucker, right? And it causes you to salivate a little bit. And that's what's lost when you go with dry mouth for a long time. So teaching your mouth how to do that again and using lemon drops can help that teach your mouth to do it again and prevent some of the dryness from sticking around. For sure, using a soft toothbrush and keeping your mouth clean and flossing and all of that. Dentures, if you had dentures prior to treatment and your weight has changed a lot, dentures can be ill-fitting after. And it can rub on the gum lines and cause some infection. It can open it up to lead to infection. The mouth is very vascular. And so sometimes dentures need to be refitted after so that you don't have pain in the mouth or higher risk for infection. Sometimes you have to just avoid the sharp, crunchy foods. Sugary foods are bad. They lead to more decay for sure, but also dry mouth. And then for sure, eliminating alcohol and smoking if that's an issue. Next, we look at weight changes. So I do see there's a question in the chat and from Derek, and we will address that at the end, Derek. Thank you so much for posting that. In terms of weight changes, some people have problem with weight gain and some people have difficulty with weight loss, and either one is equally troubling for patients to have to manage. Sometimes there are medications that are causing weight gain that despite best efforts and good nutrition, it still leads to weight gain. And sometimes the patients lose a lot of weight and have a difficulty putting weight back on, which also makes it hard to regain that strength and stamina after. And so we encourage you to work with your team to ask for a referral to a dietitian if that's what is needed, to get some support if weight change, gain, or loss is an issue for you in survivorship. Difficulty swallowing is the next one, and that does happen again, both from chemo, radiation, sometimes surgery, depending on what was involved. Anytime kind of head and neck cancers are involved, or there's any surgery or intervention in the head and neck, swallowing can be an issue. And so again, working with our team that is like speech language and having swallow studies to be able to fix these problems, but you have to be able to talk to your provider about them, let them know what's going on if things have changed so that they can intervene. Next one is bladder and bowel control. So again, something that you may have completely not thought of or put aside as not a very important thing during treatment because you had so much going on, but can be one of the most upsetting issues after cancer treatment when you realize it's still going on after treatment is done. A lot of people start to shy away from social situations because of this. It can be a result of treatment. It can be a result of surgery, structural things. And it may lead for some people to have kind of no control or frequent trips to the bathroom, which, you know, makes you not want to be on long car rides or in social situations or out with friends. It might change the dynamic of your social life. And so even there can be problems with constipation, as we talked about in terms of neuropathy. And so it's really important that these things do get discussed because there may be medications causing this that can be adjusted. It could be that simple. It may need a surgery. It may need a specialist. But if you don't talk about it, then nobody's going to know about it and be able to help. Next is menopause symptoms, and we could probably have a whole session just on menopause symptoms. And so super important to address this because for some women, they've, you know, when they start treatment, they've already been through menopause and are over having symptoms, and symptoms come back or symptoms return. But for some women who are not menopausal at the time of surgery, they go into what is called a chemical menopause. And so they really weren't prepared for this. And it does kind of create some emotional issues because it's one more kind of thing that you lost control of during cancer treatment. And so not only is there a loss of fertility because of surgery or chemo or radiation treatment for your cancer, sometimes there's a chemical menopause. And so things change very quickly, and women weren't prepared for that. They were preparing for chemo and chemo side effects or radiation and radiation side effects, not to live in a whole world of menopausal symptoms when they weren't prepared for it. And so we're talking about things like maybe they stopped having periods, hormonal changes in the body that can cause all kinds of issues basically throughout the entire body. Next slide, Shannon. Hot flashes, and, you know, and for anyone who's lived through hot flashes and survived and come out on the other end, to have to start this all over again and start going through this again is very, very troublesome. It could decrease libido for sure, vaginal dryness, bladder issues, leakage. This can lead to fatigue and sleep problems, of course, and memory problems and depression. So if we didn't get hit with them from the you know, side effects of treatment, now we're going to go into them and get them all over again with menopause. So there's all kinds of resources in terms of dealing with hormonal changes, hot flashes. Maybe hormonal supplements are something that would be right for you. Again, these are conversations that you have to have. In terms of libido, we're going to get into kind of intimacy, but this can be a game changer. You know, we say in terms of hot flashes, dressing coolly, wearing cotton, dress in layers, all drink plenty of water, all of those things. And so hopefully some of them can help, in even if it's in a small way. Next slide, please, Shannon. Super important, I think, to talk about body changes and intimacy. This is one of the things for sure that gets put on hold very often during treatment. For sure, you have more important things to think about than intimacy. You don't care what your body changes, what body changes are happening, because you just want to survive treatment. And then you transition into survivorship, and you don't have to worry about chemotherapy anymore. And your body is back to being yours, and it's not going through a cycle of high counts, low counts, or hot flashes, whatever it may be. And you start to realize there's been some big changes that may concern you after treatment. And for sure, some of them are visible and some of them are not. Sometimes it causes feelings of being ashamed or afraid. It can certainly be hard on your loved one or your partner. May be troubling enough to you that your libido, if it's not getting impacted by hormones or surgery, The way you feel about your own body can change so much that you have little to no sex drive, making you feel worse or further impacting your relationships. We say, next slide, Shannon. At least half of women treated for breast and reproductive organ cancers, so that's ovarian cancer, cervical cancer, endometrial cancer, and more than half of men treated for prostate cancer report long-term sexual problems. So majority of survivors are going to have some issue with long-term sexual function. Again, this is one symptom where patients will say, I was absolutely not prepared. And as a provider, it's not the first conversation I have when someone's getting a diagnosis of leukemia and needing a bone marrow transplant to go into the whole talk about changes in intimacy and sex, because their priorities are in a different place. But what happens is this kind of lack of priority does linger through treatment sometimes. And then in the post-treatment phase, it's time to take control of your life and time to get things back. And now you're experiencing problems with this as well. Next slide, please. They can be related to surgery or chemo, radiation effects, medications. Who knows? You may have no clue what it's related to. It could be emotional issues. So anxiety, depression, guilt, body image stress, any of those things, or a combination and a perfect storm of all of them together. And it really kind of has to be worked through. And I can assure you that if you don't bring this up in your appointment to your provider, there is a 99.999% chance they're not going to bring it up to you either. And that doesn't say very much for us as providers. But patients often come with a list of things that they want to talk about, and almost never is sexual dysfunction or lack of intimacy or decreased libido or body image disturbances are on that list, because you feel that it's not something we feel is important enough, and you also feel there are so many other things that have to be addressed that this just doesn't come up into the priority list. Some of the next slide, please. Some of the other concerns might be worry about how to become intimate again after treatment. Maybe because of surgery, treatment, hormonal changes, you may not be able to have sex as you did before. We're bringing back all those menopause symptoms that get kind of mixed in the whole picture of intimacy. There may be a loss of fertility that is really causing some distress. Erectile dysfunction is really, really important. Again, if you don't bring it up, we probably won't either. And there are some simple ways to treat this. Sometimes it's as easy as a medication. Sometimes it's as easy as someone saying, you have to try new ways. You have to do new things. You have to practice at this, and you have to be okay with it taking a little time till things work well again. But if we don't talk about these issues, you'll never get those responses. You'll never get the prescription. You'll never get someone checking in on this, or a referral to a specialist if that's what's needed. We talk about intimacy after treatment, and this is really a hard issue for lots of people to address, especially if, and it's very normal, you didn't talk a lot about this during treatment, that this really did get put on a back burner. And it's easy for me to say, be proud of your body. It got you through cancer. You're here because your body was able to get you through all of this. But there are some practical little things like, you try to look better. If you get dressed and you do your makeup or you do your hair, or you put on something nice, you just feel better. We have a old oncologist that's long since retired, but she used to crack me up when I was just a young nurse practitioner starting out. She would say to her patients, just put some lipstick on, you'll feel so much better. And I used to think, how wacko crazy is that? But in the years that I've done this, there was a program called Look Good, Feel Better. And it's true. When you look good, you do feel better. And that might just be getting a haircut, or putting on some makeup, or putting on some clothes you haven't worn in a while, or getting yourself done up to go out and being outside of the house. Or for some people, it's really just as easy as getting out of pajamas because you haven't done that in so long. And so we say, you need to be able to touch each other, and it might be touching each other in ways that are different than you did before. And for sure, you have to be open to change. Things might not work like they did before. They might not feel like they did before. It might take longer than it did before, but you have to work together on this one and keep trying and get help when needed. And talk to your healthcare provider, because we're terrible at bringing this subject up. The next kind of thing we talk about in survivorship is the fear of cancer returning. And while that is unanimous, if I asked for hands, I would get 100% of hands, I'm certain. It is completely normal is very, very strong after the first year of treatment. In fact, people live for the next scan and are so anxious to get to the next test. And it takes a couple times of going and seeing that things are okay before you even let yourself believe that it's actually going to be okay for a lot of people. Sometimes this produces such a strong feeling of anxiety that you literally rob yourself of the ability to enjoy life. And for some people, it's very up and down, I would say, for the majority of people, where you're doing okay. It's been a while since your visit. You've talked yourself down from the ledge, but next week there's an appointment, you're getting blood drawn, you're having a scan, you're having a mammo, whatever it is, and it all kind of comes back. And we call these kind of trigger events, or it might be coming up to the day you were diagnosed, the anniversary of the day you were diagnosed, or the day you finished chemotherapy, or the day you had your surgery. These are all trigger events, and you wake up feeling like you are so fine, you are so good to go, you got all of this like no problem, and then a trigger event kind of pops into your mind and you're in shambles, really anxious, kind of, the anxiety is back, and it's all very normal. The first year is usually the worst, and it does decrease over time. And I liken this to grief. When you lose somebody, grief never ever goes away, but it changes over time. Somehow it might hurt as much, but you deal with it differently, or you may be able to talk about somebody without crying years after they've been gone, but maybe not for years, until you get there. The fear of cancer returning is very much like that, very, very strong in the beginning, often triggered by events, but it does tend to get better over time. Having said that, if the fear is crippling, if it's leading to depression, then we really need to be able to address it. You need to be informed about what are your risks for recurrence. We tell people, we used to say cure, and then there was this great big debate over not using the word cure. We say no evidence of cancer, and is that 3 years, is that 5 years? And I don't have the answer, and I don't know why, if at 5 years you can say cured, why you at 4 years and 8 months you can't say cured. Like it's just one of those things. And now we use the terms no evidence of any cancer. But if you're informed and you know the likelihood of your recurrence, and you have a high likelihood of recurrence, then you're watching closely. And if not, then you're following guidelines, because we know there's not a high likelihood of recurrence. And so it's kind of exchanging that fear over time, the fear, the anger, the sadness, it's exchanging for that for being a little more positive, for sure, not blaming yourself for the cancer. I tell people this, and I want everyone to hear this. You don't have to be upbeat all the time just because you beat cancer. Yes, it's amazing that you're in the survivorship phase. Yes, it is amazing that you are done treatment, that you survived, but survivor's guilt is very real. And lots of people, feel like they're watching somebody else go through it, or they hear of somebody else's diagnosis, and there's this guilt that you made it through and you're going to be okay and someone else didn't, and that just comes. So you need to change those things with looking for positive. You don't have to be upbeat all the time. It is okay to have a little pity party every once in a while, as long as you can change back to positive and pick up where you left off, and make some meaning of what that really does mean to you. Be able to find ways to relax and be active, and then really focus on what you can control, because what we know unanimously from cancer patients is that the hardest part is that feeling of loss of control. Cancer took so much away from you, and this is your time in life to take that back. Next slide, Shannon, please. In terms of depression and anxiety after treatment, it's very normal for feelings to continue or to resurface every now and again, to not be upbeat all the time. But if they're worsening, if they're interfering with your daily life, if they seem to be more problematic than not, if people are, trying to get you out and you just can't get up and out, then maybe it's time to kind of have a good discussion with somebody about whether or not you need some help for this. So that it's easy in next slide, please, Shannon. It's easy in black and white for me to put a slide here to say, if you have, and it sounds like a commercial for side effects, right? Take this drug. If you experience nausea, vomiting, diarrhea, or constipation, and call your healthcare. So if you have the following signs for more than 2 weeks, talk to your healthcare provider. But we know that in real life, it isn't that easy. So it's about thinking about the symptoms and trying to figure out, are these coming from kind of a physical problem? Do I have pain that isn't managed? You know, am I struggling because of shortness of breath that could be related to a low hemoglobin or loss of blood? Or am I feeling so down? Am I feeling so out of control that I just can't get a grip on the depression or the anxiety symptoms? Next slide. Are the feelings of worry, anxiety, or sadness just not going away anymore? Am I not getting a break from them? Or am I so emotionally numb that I just don't want to deal with it? Do I feel so overwhelmed all the time that I can't handle the issues because I'm so overwhelmed? And there's physical symptoms like shaky, but there's emotional symptoms like you're short-tempered and moody all the time, and it might be family members that point this out to you. It might be that you're having a really hard time concentrating and nothing, you just can't get it together anymore. And maybe that's just anxiety that hasn't been dealt with, or depression that needs to be addressed. And so these are conversations that need to happen so you can get the help you need. The next slide just really goes through kind of more symptoms and signs of depression and anxiety. And for fear of making you all very depressed tonight, I'm not going to read them all out. But the point in all of this is that if you're having kind of these symptoms, then it is worth a discussion with somebody. It might be situational, but it might be something that actually needs some help and some work to get you through. The next slide is relating to others. And this is another one where, kind of comes near the end of the talk and we don't put a whole lot of thought into it, but I always get a lot of head nods that after treatment, when you're trying to reintegrate into some of the work or social, for some people, it's getting back into clubs or things that they enjoy doing. That return may be very challenging. It may feel like you don't know how to talk to people anymore, or you don't want to talk about your treatment, and people ask you all the time. I remember early in the Renew series, we were talking about who is a survivor and what is a survivor. And one of the women that was attending who had been through breast cancer said, she raised her hand and she said, I feel really bad for saying this, but I need to say this. I don't want to wear pink everywhere I go. I don't want to row and I don't want to race. I don't want to do a 5K and I don't want to run in pink. I don't want to be labeled breast cancer survivor for the rest of my life. And I just can't wear a pink ribbon and my socks can't be pink and I don't want to have it on my car and everywhere else. And it kind of struck me because I thought how I've always felt so proud of the breast cancer population for their willingness to get out and wear pink and raise money for the cause. And while it's all really good, not everybody feels that way. And it's okay to not want to wear pink socks or do a 5K race for breast cancer or continue to be labeled as a breast cancer survivor or a prostate cancer survivor. That's all okay. It's everybody's choice. And some of that relating to others is really deciding, do I want everyone to know I'm a survivor of a certain type of cancer? Or do I practice how to shut this conversation down and move on, because that's what I want to do with those conversations, is just move on from it. So there's just a few tips here in terms of relating to others. So especially early during treatment for sure, but early in the post-treatment phase, accepting help is sometimes really hard for some people, but there have been people waiting in the sidelines just hoping you would give them an opportunity to help somehow. And letting somebody help that may have been waiting is a really good way of starting to relate to others. It might be your first trial for having the conversation or not having the conversation with somebody. Addressing problems as they come up when you're returning to work or school. Again, learning how to shut the conversation down, or knowing what you're going to say, or knowing how to deflect it if that's what you want to do. For some people, if you didn't keep up contacts during treatment and you were one of those people, which is totally fine, that said, I need to get through this. I need to, put my nose to the grind for the next 3 months. I got to get through I appreciate your phone calls and your cards. We'll talk later. Sometimes it's hard to then pick up at where you left off after that. For sure, knowing what you're going to say or knowing your limits about how much you're going to talk about your treatment, your recovery, your symptoms, whatever it may be related to your cancer is super important, because then you control the boundaries that get put on those conversations and how you relate to others. Finding meaning after treatment is super important. So now, in addition to recovering physically, it's super, super important to figure out what this cancer and this journey has meant to you, and what it's going to cause you to do for the future. Change the way you live, change the way you relate, or go right back to how things were, because that's what you did all this for. I always say to patients, you went through this, you went through chemo, you did the surgery, you did whatever, so you could live. And there's a time to start living again. And that might mean you have to get social again, or you start doing family things again, or you mend fences that have been broken along the way, because you just don't want to live with that kind of hurt anymore. Opportunity is born out of adversity, and going through a diagnosis of cancer where everything about control of your life has been taken away from you, and you've been, at everyone's mercy to get you through treatment. It is okay to have a different view of life, to have make meaning that says you're going to be more spiritual or less spiritual, or more social or less social, or you change your job or change whatever it is for you. So, I always say change and strength are born here. This is the time now. You're in a new phase. You're through your treatment. It's okay to grieve your losses, acknowledge those losses and grieve them. Assess your life, talk with others, get the support you need, find out what resources are out there that would work for you, and really make meaning of this life after cancer. Next slide. So this is just, this is the end of the talk. And these are just some of the, you can flash through them. They're in the package that you got, some of the resources that are available. I will say Canadian Cancer Society and Hospice have really amazing programs. You do not have to be end of life patient to attend hospice. They have lots of support groups, community events, wellness. They have lots of wellness talks, events, groups, and some really great things there. And everything they have is online on their website as well. And so I invite you to seek out the support and the resources that you might need to really optimize your survivorship and life after cancer. So that brings us to a close. There is one question in the chat that says, is there anything we can do to improve neuropathy, numbness in the fingers and feet, or is it a time thing? So excellent question, Derek. I wish I had a really excellent answer, but the answer is there isn't much. So physical activity and exercise is good. That can be hard depending on the degree of neuropathy. There was some very kind of loose evidence that came out about 10 years ago saying a B6 complex vitamin was critical for nerve healing. And while we know that lots of people can get B6 in their diet without supplementing with a B6 complex, so there was a short period of time where they did recommend taking the B6 complex vitamin in addition to a multi, but that has kind of come out of favor. We know that it's the slowest thing. The best thing you can do for neuropathy is to protect from heat and cold, protect from, the risk of infection and those kind of things, and then exercise. Yeah. Thank you for that question. Does anyone else have questions? Feel free to unmute and ask, or just put it into the chat. There is another one. Fatigue has been my biggest hurdle. Breast cancer lumpectomy with radiation last February. Does the fatigue get better? You're welcome, Derek. Fatigue does get better. And I do another program.
Just hit the little arrow button.
No, I'm not. I requested, yes, I've requested chat, have I?
So Graham, you're not muted. Are you
Okay.
asking a question?
Okay, yeah, I had radiation treatment, oh, good Lord, when? October, November? And I have found that, I take naps every day, but heck, that's not bad. I get up and then I stay up half the night. But other than that, I'm doing good. I'm happy. I'm confident. There's days that, some days I have real good days. Other days you have a down day, but heck, I'm feeling that's normal. I'm not worried about it. I'm not panicking.
Your question.
And,
Your question.
it's just that, radiation, what can I expect afterwards? I know there was one side effect. I have cataracts, or shall we say had, and the radiation treatment, believe it or not, seemed to uh, get rid of the cataracts. I take my glasses off and I can see a lot better, and I can't get my eye exam until January again. So they had given me thick glasses. I went back to an old pair of glasses, and they worked really reasonably good. But uh, radiation, it did help my sight and help my cancer. I just got the report back from my oncologist that, hey, that tumor shrunk, it's gone. So I'm happy. Other than that, nothing to say. I'll just mute
All right.
myself again.
Thank you, Graham. That's great to hear. And I think you make a really good point about you have some good days, you have some bad days. And so what we know is, like I said, you don't have to be upbeat all the time. You've been through a life-changing event, but picking up, and moving forward after a bad day is super important. And thanks, Graham, for your insights. I'm going to go back to the question, about fatigue. Breast cancer lumpectomy with radiation last February. Does the fatigue get better? And so for most people, it does get better, not as fast as anyone would like. And I think part of that, again, is having reasonable expectations. And so you probably don't know your new normal. That's still for you to figure out. But your brain is probably telling you that your new normal is going to match your previous normal in diagnosis. And so that is likely a myth. And you still have to figure out what your new normal is. I can tell you with certainty, the best cure for fatigue is exercise. And we do a whole program on cancer-related fatigue, and the evidence studied, tried and true. There is no pharmacology that can manage it any better than exercise. And it sounds absolutely silly to tell somebody who's suffering with significant fatigue to exercise. But if you can start little with 5 minutes and you can increase that, you will eventually kind of like tip the scales where the exercise is then producing less fatigue. It might mean you nap. It might mean you have good days and bad days. It might feel like you can't push any further, but exercise and incorporating some regular exercise is the most beneficial thing you can do. And by exercise, let me be clear, is if your normal is walking around the house, doing a little bit of laundry, carrying stuff, that's your baseline. Exercise requires you to do something where you increase your heart rate and sustain it for a period of time, 15, 20, 30 minutes, whatever it is in terms of where you're at with fitness. You sustain that elevated heart rate to create an increase in muscle work, which results in an increase in stamina. So I hope that I have maybe encouraged you to look at actively overcoming some of the fatigue, because it does get better, but there are also things you can do to make it much better or better faster. Yeah, so one of the comments about, even exercise is, you're also trying to work. Some of you are parenting, some of you are taking care of parents. Depending on where you're at in life, it is very hard to fit in some exercise. But I will say this, when you got an appointment card for the cancer center to be there for your treatment, you made it. And so when you are ready to be able to incorporate that, you might have to schedule yourself a little bit of time to do some activity that can help you get some stamina back. It will be life-changing. Anyone else with questions? Okay, well, I hope that we've been able to, number one, at least make you feel like what you're experiencing is normal, and maybe you're not alone in the fact that you still have some symptoms or are struggling with some concentration, memory, fatigue, intimacy, whatever issues post-transplant. And secondly, I hope we've given you a hope that there is a light at the end of the tunnel, that there are some things you can do to manage them and make them better, and move through this, kind of making meaning of your journey with the hope that things can get better in your survivorship days.